When you hear the phrase common cold, I mean, look, we hear this all the time. What does that say to you when you hear it? What is that to you?
Yeah, so the common cold is basically an overall catch-all term for a number of viruses that we come in contact with. Kids can get 8 to 10 viruses or common colds throughout a year. Adults more so 2 to 6 per year. So that common cold is what we come down with during that season, during that winter time. There's a summer cold season, and generally it's this kind of 3 to 5 day kind of onset, may last 7 to 10 days with symptoms of cough, congestion, occasionally fever accompanies it, but you're usually going to get better within time. That's pretty much the common cold course.
But what we saw there was one thing that I thought was very salient. It said usually not controlled by antibiotics. Is it just true to say that if you've got the common cold, you can take antibiotics until you run out of money, but it's not going to help?
Yeah, that's a great point, and that's probably one of the things we struggle with the most in the office. Patients come in, they have a cold, they think that they need an antibiotic, a 5-day antibiotic, a 7-day antibiotic that makes them better, and they may have noticed this in the past. They took an antibiotic within 5 to 7 days. After they completed the antibiotic, their cold was gone, but it was probably more so their body's own natural immune defense working within those 5 to 7 days that actually made them better. It's pretty much some supportive care, over-the-counter things to make you feel better, but it really is time and your body's own natural healing ability that's going to make you better with the colds.
How did that get started? I mean, as you've gone through your career with people who think that antibiotics will help a common cold, has it just been something that's been around a long time, or misinformation?
Yeah, I would say that probably maybe misinformation. There's a lot of education that can be had around this topic, and we do spend a lot of time in our office really trying to educate patients on the concerns for antibiotic resistance as well, for using an antibiotic for a virus. Most of the time you're not dealing with a bacterial infection with these common colds. Antibiotics are used for bacterial infections, but usually if you have a cold, it's a virus, and the antibiotic isn't going to do much but maybe give you a little bit of discomfort in your stomach or some other adverse effects.